Hey everyone, I thought I would check in and make a video kind of documenting my experience with breast cancer. And so I thought this would be kind of like a real glimpse at literally what happens after one of your chemo treatments. I am just completing my third round of AC treatment, so that is adriamycin followed by Cytoxan. And today was day 3. So this particular treatment has 4 treatment plans before I go on to Taxol for 12 weeks. So I'm a little bit over the halfway mark for the AC treatment, which is really great. And I had my third round today. So I thought it would be important to come home from the hospital and actually do a live video showing you kind of how I'm looking, how I'm feeling, and just very candid about that whole experience. So I preface all of this with, I'm incredibly tired. I think after I make this video, I'm going to take a nap and just kind of recover a little bit. But the days at the hospital have been long. I go in the morning, I get my blood drawn, and they want to check all the white blood cell counts and the platelets and just to make sure everything is normal. After that blood work gets passed, I meet with my oncologist and my nurses to kind of talk about any side effects I've been having, questions, concerns, etc. And so I know I made a video a couple weeks ago about my port, and so if you haven't seen that video, I do encourage you to watch that to learn about the port and how they administer the chemo. And between round 2 and round 3, my port actually got infected. And so if you actually look back at that video, you will see what I thought was healing ended up being really red around the port area and turned into an infection. So if you want to see what an infection looks like, you can go back to that video and take a closer look so you guys would be aware, if you are going through this type of treatment, what to expect with an infection. So I caught the infection pretty early, which was great. I noticed redness around the port area and was on antibiotics for about 5 days. So when I went to check in with my oncologist after 5 days, it really looked like the antibiotics did not have a large impact. And so the response was to go to surgery and have the port removed. So that way the surgeon can take a closer look internally and kind of clean out the infection as needed and kind of reassess the situation. So this all happened last week. I went in and they removed the port. The doctors were really great. They're like, you're going to be on a port vacation and without a port for a little while. And let me tell you, it's so great to be without a port. I feel like I have all this mobility and very little pain. But I did want to show kind of like what that area looks like now. So I just have a couple sutures, and it's kind of bruised, which I think is like the color that we're seeing now in the video. But I'm just going to keep it covered like this, and then I have some waterproof band-aids I put on, and so when I shower and everything, just to keep it wet, or not wet, and just cleaned and dab dried, etc. So that's the status on the port. So right now the port, I don't have a port. The surgery is healing, and once I'm completely healed and no longer have an infection, we will have a conversation about getting a port put back in, since I still have 14 rounds of treatment to go through. So that brings us up to today's treatment, the third round of AC, and because I don't have a port, they administered all of the chemo through my arm. And this was very new to me. I've never done this before. Outside of getting a couple blood tests done through my arm veins, I wasn't very comfortable with having chemo administered through my veins. But I just wanted to kind of show you, they used I don't know the name of the apparatus, like the IV catheter, in the forearm of my arm, which surprised me also. I know I've had IVs in my hands and I've had IVs in my elbow, and I've never had one actually in the forearm. So just for those of you who are watching, that's a possibility too. I wasn't prepped for it. I was quite nervous, but it went fine. And the nurses were really great. They were talking to me about all of the sensations you may be feeling, more so in this smaller vein than you would in the port. When I've had chemo through the port, to be honest, I didn't feel anything. They kept changing the little bags of different medicines they were giving me, and I didn't feel a thing. When it was through the arm, I felt it a lot more, for better or for worse. They gave me Decadron, I think, as like the first primer so I don't get too nauseous, and then some other medicines to help with any nausea and antibiotics so that I don't have any reactions, negative reactions to the chemo. So there's about a good 20 to 30 minutes of just fluids coming through before I actually get my AC chemo treatment. But the one thing that scared me, and well, I shouldn't say scared me because I don't want to scare you guys, but one of the things that did scare me was with the adriamycin, because it has to get pushed through, the nurse is actually standing there and like slowly pushing it through the veins. There is an opportunity for the patient to feel a burning sensation while that is going through their veins. And so it's really important that you have this dialogue with your nurse who's administering that, to let her know if you are having any burning feelings, so that way she can reassess the situation and make sure there's no further complications with how the medicine is pushing through the walls of your veins. So luckily I did not have that sensation, which was really good. I'm glad I didn't have any complications, just because I didn't want to have to delay chemo any more than I already had to with the infection of the port. So we got the AC treatment through. You could totally feel it going through your veins, and followed by the Cytoxin, which was just by drip and then kind of went through my veins as well. And you can really feel it like pulsing and flowing, which was just a weird feeling all in general. But I survived. I did it. But I am exhausted. I have to say, just mentally being at the hospital from 9:30 in the morning until 3:30, 4 o'clock in the afternoon, in waiting rooms, getting blood drawn, going through chemo, is quite exhausting. So I just wanted to kind of give a recap of where I was and the new content I can provide for those who are considering getting chemotherapy through their veins versus the port. So now I feel like I can talk about both experiences. My plan is to probably get it through the veins for my last treatment of AC in 2 weeks, and then hopefully I will be all healed, the infection will be gone, and I can work with my doctors and surgeons to talk about the placement again of getting the port back in. So that is my update for now. I'm probably going to take a nap. It's nice chatting with everybody, and we'll chat again soon. All right, ciao.